So this is a image of the foot with the implant put in. And this implant, the purpose of this implant was to increase his arch height. And it was painful. It increased your pain. And so it was removed about 2 months later. Is that right?
11 weeks.
11 weeks later it was taken out. After that you had 7 weeks of therapy 3 times a week. And they worked really hard with you, had you on a treadmill and all kinds of exercises. And anything else they did with you?
Well, they'd put the TENS unit on it for a while.
Yes, yeah. So they were treating the pain.
I didn't really care for that. It didn't
Yeah.
seem to help.
Yeah. And they did a little bit of hands-on work. How long would they do the hands-on work on the foot?
Oh, maybe 5 minutes.
Okay. All right. So anyway, this is a reading on his MRI report, and this is dated 2016. Is that correct? Mm-hmm. You had the MRI then?
Yes.
Okay. And so it reads, multifocal osteoarthritis, which is severe at the posterior subtalar joint, moderate to severe at the articulation between the lateral malleolus and lateral talar body, of moderate severity within the lateral aspect of the tibio-talar joint, moderate severity at the third tarsal-metatarsal joint, and mid and fifth metatarsal joints, tarsal-metatarsal. The peroneus brevis and longest tendons are intact without tear, synovitis, or tendinosis. Edema and or fibrosis present within the sinus tarsi, raising the possibility of sinus tarsi syndrome. And this is when you had a moderate amount of pain.
Yeah.
That was the purpose of the MRI, was to look at pain. Now, if we look at those words, it sounds terrible, right?
Yeah, it's scary.
You know, it sounds like, oh my gosh, there's a lot of wear and tear at this foot and ankle. But you have to look at it in context. And your osteoarthritis in that joint developed over time. And it developed probably as you described. You were doing logging for many years, and you were pushing off that foot using your chainsaw. And so it developed slowly over time, and that's your body's way of adapting. Now we know that because of that, those osteoarthritic changes are there. We know that your foot moves less than it moved when you were 20. Okay, but that's all right. You know the body tolerates that. It seems like part of the pain was mediated by the fact that you had lost all motions in that subtalar joint and midfoot, and so you were hitting hard on it. And does that feel familiar, hitting hard on it?
Yes.
So it didn't dissipate those forces. It was as though my wrist is at end range and you keep hitting my wrist. You know, I can feel the pain right now. So yesterday we worked on your motion, and I was really concerned as to whether or not I'd be able to increase your motion. And I was really pleased that we did increase your motion. And tell me how you're doing today pain-wise.
Oh, I'd say 50%. It's better.
Yeah.
Less.
So 50% better, 50% improvement.
Mm-hmm.
And then today, the goal is for your rear foot and midfoot to pronate more. You were walking on the outside of that heel, mm-hmm. and you could feel that you were weight bearing on the outside of the left heel.
Very much.
And so my goals of mobilizing all those joints was to increase your ability to pronate, to restore movement in that direction. So how long did I spend yesterday, and how was that different from the hands-on work you received elsewhere?
You spent 20 to 30 minutes.
Yes, yeah.
Yeah, I would say. Just that, along with other things we were doing, but then they usually about 5 minutes.
I see.
Physical therapy.
Yeah.
And it wasn't near as aggressive as what you were doing.
Yeah. Did they do as many different directions as I did?
No.
Okay.
No, they did about two different
two or three directions. Yeah. It's the foot ankle is a very complex structure, and the movement is very complex. Your midfoot moves in a very different direction, in a different plane, than does the rear foot. Mm. And the rear foot's really complex. It moves medially and laterally, but it also rotates in the transverse plane. So you have to address each of those. The fibula connects to the ankle. You need to treat it at both ends sometimes. But anyway, we experimented today on putting a lateral wedge, and I don't know that the camera can see this, but it's about a 1/16 of an inch over here, and then it's a 1/4 inch out here. And so we put that in your left boot to make the heel go outward, which would make the foot and ankle pronate more. And you felt like that was positive.
Yes.
What did you think of it?
Yeah, it felt more balanced, felt better when I hit. I didn't feel that little rolling motion to the outside.
Very good. Good. So it's something that you can experiment with, and maybe you don't need it long term. Maybe it'll retrain your foot and ankle, and maybe in 3 months you can pull it out. Maybe you need to adapt to it so you don't get sore with it. So maybe 8 hours a day isn't the best thing to do with it, but why don't you wear it a couple hours in the morning, a couple hours in the afternoon, and build that up. And then in about 3 months, see what happens if you try and wean that.
Sure.
Okay? And I don't think, I didn't film you before in terms of your gait, your walking. I didn't film you before, did I? Yesterday? No, I only filmed after we had treated you, correct?
Mm-hmm.
Okay.
Right.
So, I mean, you obviously were painful with your walking. It was limited.
Very big.
And you definitely, were leaning over to unweight that left leg. And we had you buy a cane yesterday. And today your gait is very nice. It's looks so much better with the cane. So that'll be a good tool for you to use, and also try to wean off of it in 3 months. And use it intermittently. If you're going shopping, you're going to walk a lot, you need it.
Sure.
But if you're just walking from the living room to the kitchen, I don't think you need it. So let's look at your foot and ankle, and let's show the movement.
This way?
Yeah. So yesterday we filmed the restriction of the foot and ankle, am I correct? Okay. Did we film after the treatment?
Yeah.
Okay, so I did 2 films.
I think so.
Alrighty, okay. So this is midfoot, and I can feel a distinct movement into pronation. And this was blocked yesterday before treatment. There was no movement in the cuboid going up and down, and this is much freer. And there was no subtalar rotation, and now I can rotate that. I can pull it outward into eversion, and I can push it into inversion as well. So if we compare sides, there's a little more movement on the right side. Will I make this one equal with this one? I don't know. But I'm pleased with the gain in motion that we do have. And maybe over time we can get them equal. Time will tell. But I'll continue to work on this, as you say, aggressively, although I don't like that term.
I know.
I
didn't think of that.
because I'm very gentle with the joints.
You are.
So I'm would more appreciate another word, but I don't know what that would be. Maybe thorough.
Okay.
Yeah, how about that? Alrighty. So you're also, we taught you some exercise where you twist your body to get that foot to flatten repeatedly, and we'll add more strengthening to that, more range of motion exercises. And I think that now that we gained the motion, now those exercises will be very beneficial to you. Whereas before, you were like on a peg leg.
You're
It
exactly
just
right.
didn't give, just didn't yield
Yep.
at all.
I agree.
Good. So we can stop filming.